My name's Alysa Zalma. I'm a psychiatrist. I've been practicing here in the state of Oregon for, I think, almost 20 years, which is kind of crazy to think about. I did part of my training in Boston, and I completed my training here in Oregon. I specialize in a lot of different things in psychiatry, depression, anxiety, trauma. But mostly within the practice of psychiatry, what I really like to consider is having people tell their story, which is the mainstay, I think, of what psychiatry is. Kind of bridging professionally what I do and my interest in the project is the ability and the hope for people to be able to tell their story. So in working with you as a co-author on this project, I've had this amazing experience of utilizing what I do every day in psychiatry into a highly creative venture about other experiences of having other people tell their story. And the more wide-ranging hope and vision I have for this project is through your incredible work on the topic of children of adoption, which includes areas that I am interested in, includes areas of trauma and attachment theory and lots of different slices of psychiatry that I really enjoy and that I feel well versed in. That this becomes already a bigger project in terms of different themes of the human condition around wanting to tell one's story, wanting to belong, understanding what trauma is and understanding what healing is, understanding how to move through and move past that. And it is specific to people who've had the experience of adoption and what that brings in terms of traumas that people may have. And also for people who may not have been adopted but will, I hope, resonate with different pieces of the book in terms of experiences of traumas, whatever they are, experiences of becoming whole again and healing from various modalities. And I don't usually get to talk a lot during my work. I usually listen a lot, so this is also a very different experience for me because I actually get to talk a lot. So the idea of letting someone give a history as opposed to taking a history. Allopathic medicine, especially when one trains in medicine, as a medical student, you're sent into the emergency room or you're sent into the pediatric ward, you're sent in wherever you're sent in, and you're told, all right, go in there and take a history. And then you have your list of the questions you're supposed to ask and what are you thinking in terms of your history of present illness, and you got to compile information so that you generate a differential diagnosis and you figure out, quote, what's wrong. When people have a lot already taken from them and they want desperately somewhere to come tell their story, a lot of times they don't want anybody to take a history. And the way you let someone give it is you don't ask a lot. You understand that someone wants to tell you. And it has been stunning to me how much information someone will give you if you hardly say anything at all. And it's not just in the not saying, but it is a feeling of not so much physically moving back, but metaphorically giving metaphorical space in between two people so that that person feels a container, a safe container, so that they can give the story. The past is live in the present in that you don't want to re-traumatize anybody. And actually, our work in terms of this book feels to me a lot more about hope and about moving forward instead of moving backwards into a repeat of trauma. This work is about traversing trauma and moving forward and not getting stuck into loops of past traumas that then people feel compelled or doomed to repeat. What I have found through this work is, and I hope that our readers will experience this as well, the power of a highly creative process, that as you get involved in something that resonates with you, you gather energies that you didn't actually know that you had, and that you find areas of not really expertise, but areas of sense of self and identity that you start to build on. You came to me and you said, well, will you co-author this book? And I said, all right, well, if you want me to try to, if you will, put some, not really scientific, but psychiatric backbone into this work, so that I will put in some attachment theory, which is in this book. I will put in some psychoanalytic theory, which is in this book. I will put in different citations and experiences of different American psychologists who have become very famous for various reasons. That's all in this book. I know what I have learned to love about your writing style is that it absolutely gallops with so much emotion and so much actual feels like suspense. I remember reading the chapters before I write my commentary and literally just like reading so fast because I feel like I want to get to everything else and try to put it all together. And you criticize it, but these like amazing, big, delicious run-on sentences that just kind of keep going and going that I absolutely love. Our writing style has developed over months in that I think at first, again, my style, and this is, I think, portrayed more in the earlier chapters, that it is more academic and it's more kind of puts that kind of backbone into the story that balances it. We started kind of at very different places and have come to a place of really vibing with each other through our writing and vibing with each other through learning how much we get along and what good friends we are now. And one of the things you've taught me in terms of dreaming big is not letting things stand in one's way, not accepting reality as it is, and that's the way it's going to be. There's a level of dreaming big that is just so important, and that's part of what this book is about through each character and through your odyssey and experience, that is so available to people. It's so palpable, and that's actually what I like about your writing style and how our writing style has come to evolve, about this idea about really dreaming big and getting the energy and the creativity behind that to really feel that is possible, and then be doing it as part of one's everyday experience.